Hi, and welcome to Rapid Respiratory Review. Today we're going to be talking about mast cell stabilizers. Mast cell stabilizers block leukotrienes and histamine through the blockade of a calcium channel essential for mast cell degranulation, thereby preventing the release of histamine. The two drugs we're going to be talking about today is Intel, cromolyn sodium, and Tilade, nitrochromyl sodium. So how you can know what drug you're dealing with or mast cell stabilizers is you can look at the generic name, and if it says sodium at the end, it probably may be a mast cell stabilizer. So now let's talk about Intel cromolyn sodium. The mechanism of action, it inhibits the release of histamine and leukotrienes through IgE-mediated pulmonary response. So blocks IgE, so you're not going to get the response from the environmental allergens. The dose, you give 20 milligrams per 2 milliliters of water 3 to 4 times per day. Its primary indications, it has prophylactic maintenance for patients with severe bronchial asthma or exercise-induced bronchospasm. Its secondary indications, allergic rhinitis, so inflammation of the nose, diarrhea, and systemic mastocytosis, so you have increased number of mast cells, or ulcers of the oral mucosa, non-specific inflammatory bowel disease. Contraindications to Intel is hypersensitivity, some side effects, local irritation, bronchospasm, urticaria, maculopapular rash. So if you get redness and bumps on your skin, that could be caused by you taking Intel. You may get flu-like symptoms, cough, sneeze, and congestion, and you may get nosebleeds or epistaxis. Just to comment about this, it's ineffective for acute asthma. Both the mast cell stabilizers are not effective for acute asthma attack, and max effect seen after 4 weeks. So you'll take the drug for 4 weeks, and then you'll start seeing the max response. And it can sometimes control exercise-induced asthma. The next drug we're going to be talking about is Tilade, nitrochromyl sodium. Like I said in the previous blurb, that ending in sodium, you know it may be a mast cell stabilizer. So what's its mechanism of action? It inhibits mast cell cytokine release, controls synthesis and release of pro-inflammatory cytokines, and inhibits eosinophil chemotaxis and adhesion. And like I mentioned, eosinophils are the main component in asthma for the response. The dose, you take 2 inhalations 4 times per day at 1.75 milligrams per actuation. The primary indication is prophylaxis treatment for mild to moderate asthma. Unlike Intel, there is no secondary indication, so this one, Tilade, is just used for the asthma. Contraindications, hypersensitivity, side effects or negatives about it, it has an unpleasant taste, headache, vomit, and dizziness may occur. And just a comment about it, not useful for acute asthma like Intel, and equally as effective as cromolyn sodium. So if you're not treating the secondary indications, you can use this too. The benefit of this is you use it 2 times a day versus cromolyn sodium, which you take 4 times per day. Thank you for watching, and next time we'll be talking about leukotriene inhibitors. See you later.